welcome to today's Real Talk. Community starts here, discussing mental health in an unequal world. My name is Christina Furtado, and I am the Mental Health and Wellness Specialist for Guard Me Cares. I do want to begin by acknowledging the Indigenous peoples of all the lands that we are on today. While we meet on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we all call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast, we acknowledge the ancestral and sacred territory of all the Inuit, Métis, and First Nation peoples that call this land home. Please join me in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how we are and can each, in our own way, try to move forward in a spirit of reconciliation and collaboration. Thank you. Now, while the pandemic continues to impact mental health around the world, our perception of mental health issues have transformed. We do, however, still have quite a ways to go to make it a health priority. Today's discussion is about increasing awareness. It's about improving mental health and well-being and creating a global community where mental health is universally valued and available. Together, we can make mental health and well-being for all a global priority. Today, I am joined by a group of panelists that I truly am honored to share the screen with. So I welcome them. Hello, everyone. Thank you. First up from New Zealand, all the way from New Zealand, and it's quite early in the morning there, so even more grateful to have Anil with us. Anil Taplial is noted for his long-standing work on strategy, policy, and implementation of mental health tools and services to improve access to information, care, treatment, and ongoing social support. His work is highly regarded for leading transformation in improving access to mental health care by seamlessly embedding innovative digital solutions within the mental health care pathways as part of a stepped care solutions in many international jurisdictions. He currently serves as an advisor on 2 committees at the Department of Prime Minister and Cabinet in New Zealand, one being of mental health and the second of data and digital. Now, to quote Anil, he says, "We must focus on the service user, their families and carers. If the mental health solutions do not work for them, then they do not work at all." So thank you, Anil, for joining us. We also have Kendall Jamal Doucette, my colleague, mental health and wellness consultant with Guard Me Cares, who has an extensive experience in mental health support, recreation therapy, group, as well as workshop facilitation, while practicing from a trauma-informed, Black, Indigenous-centered, and anti-oppressive racism framework. Central to his work, Kendall leverages his education as well as his lived experience as a member of the BIPOC and 2S LGBTQIA+ community to increase visibility, advocacy, and equitable opportunities. So thank you, Kendall. We also have Denise Wellagora, former panelist as well. Denise has a Bachelor of Science degree and over 20 years of working in the mental health field. Prior to joining the Mental Health Commission of Canada as a training and delivery specialist for mental health first aid in 2011, Denise's professional experiences include psychiatric nursing, crisis worker, justice program case manager, residential program director, and IBI therapist at CHEO. Denise has been facilitating mental health first aid since 2008, and I have had the utmost pleasure of her being one of my mentors in the last few years. So truly blessed to have all of our panelists join us today for a very, very important conversation. Now, I sort of see all of us, whether we are the panelists or those that have chosen to listen to us live or even listen to us after. We are all influencers, and we can all influence change moving forward. But change moving forward starts from home. It starts with each of us. Mental health can, in fact, be a global priority when we ourselves have patience and understanding with what someone else might be going through. Now, talking for many is the first step to giving that individual the comfort to trust, the safety to share. Listening to understanding is our first step. Today, my group of panelists are here to share their perspectives, to share ways that we can all lend an ear, lead the change moving forward, understand, and take this conversation beyond today. Now, I started off by, indicating that the pandemic sort of created a lot of different change in many people. And yet it allowed us that moment to really reflect. I want to start by asking, Denise, I'll start with you. How has the pandemic, COVID-19, how has that changed the mental health crisis?
Well, what we saw, as we know, is, I think about us at the commission, whereas March 13th, 2.5 years ago, everybody got sent home. And so, everybody was now working it at home without that support of their colleagues, of their friends. And so what we've seen is more demands put on employees, staff, because not only are they working from home, but you think about, families that then have to juggle children and having to help them through their studies. And we knew all the issues, with, kids would go to school, then they were home for, no school, and then they had to be at home. And I think that those extra, burdens, and I don't mean that in a negative way, but I'll say extra challenges that families have had to go through, that we have not seen that in the past, of having to juggle wearing many hats at home. And for those that, live on their own, that isolation to me was one of the biggest things, I think, during the pandemic. And I'm not just talking about isolation from, the people that live alone, but thinking about our older adults that live in long-term care, that live in retirement homes, thinking about individuals that had to go and be hospitalized for other medical issues during COVID, that family members couldn't be there, that support couldn't be there. And so I think one of the biggest things that we saw was people lost those links to others, those supports that they had. They weren't able to go to appointments. Not everybody has suitable Wi-Fi that they could do virtual calls and that they can see their doctor, they can see their therapist. You think about the monetary effect that that's had on people as well too, with losing jobs. So it's affected people in every single aspect of their life. But as we know, when we take a look at that definition of health, it includes physical, mental, and social well-being. And so when we look at individuals that may be living with mental health problems, that effect, when it affected all of their health, then we can see a rise in individuals struggling with their mental well-being during the pandemic.
Thank you. That's exactly it, right? And I think there's also the perspective to take is that with the pandemic, this was a collective experience of trauma.
Yes.
And historically, while yes, there has been similar experiences, the magnitude of the impact that the pandemic has actually had worldwide is, I would feel confident in saying, the first of its kind. And I think that's why it also has really shined a spotlight on something that we already knew was a concern. We've already been living through a mental health crisis. And though the pandemic really, I think, brought it to light for so many more people. Anil, I'd love to hear your perspective on that.
Kiara from New Zealand. Delighted to be on this panel. So in terms of pandemic and how it's shaped, I think I concur with all what Denise had to share. And in terms of when we think of remote, rural, we think of it in terms of as if somebody living in far north of Canada or somewhere in the middle of Australia. But I think the reality is you can be remote and so removed from other people, right in the middle of heart of downtown Toronto, for that matter. So we need to look at remote in a slightly different light as to how we can be amongst people, be so and yet so lonely. So and also looking at how communication has shifted over the last decade and a half, right in front of our eyes. And when we look at a recent research which has come out of UK, looks at how people are communicating. And when you're looking at each one of us have some kind of a device, I would assume that most of us have a phone of some order, a smartphone. Where the research found and very alarming sort of findings. Number one is texting. So if you look at the top 10 users of the smartphone, none of them are communicating via making a phone call to somebody else. Making a phone call from a phone device was number 11 activity. For the first time, it has dropped below number 10, top 10 activities of the phone. So basically, what does it say about us as people, as to how are we communicating with our loved ones? And in many ways, it can be a blessing. If you are right in the middle of a meeting, you're wrapping up meeting and you're running late to pick up kids, you can communicate with your other half and say, I'm running late, and can you go and pick up the kids? And but basically, so I may be sitting quietly text while I'm actually conducting the meeting. So in many ways, it's a blessing. In some ways, we are able to do, but then there is social media aspect, whether it be WhatsApp groups and whether it be emails, online banking, they are in the top 10, not making a phone call. So basically, if you look at the ramifications of that, and all what we have are having to endure. So I call it how we are communicating and how communication actually fundamentally has shifted. Right? If communication has fundamentally shifted, and if we see that as a new mode of communication, so whenever we are talking about whatever services, interventions, and I say, are we in those communications and the interventions and services we are providing, are we speaking the consumer's language here? If we are not there in their language, you are not going to be at sync with them. So that's why you look at some of the highest utilization of the ECBT programs around the world. The highest utilization are the ones which have got texting-based interaction with the people. And that speaks to number one, texting.
Well, yeah, I also want to jump in just a little bit, because you brought something up, and I'm sort of, as I say, I'm anchored into it. And that's about the changes of communication, right? And how we communicate. And quite often, again, those remote areas, just to use that term again, very loosely, but for the purpose of today's conversation, they don't necessarily have the accessibility, we'll say, to some of those means. So they're looking at reframing or transforming how they're even communicating about mental health. So I think when we're looking at reestablishing a more equal world around mental health, we need to take into consideration this spectrum of communication modalities, and how do we reframe that to meet, as you said, the very uniqueness of how that individual communicates. And then, Kendall, I don't know if you have something to add to that before we get into the next question, which I think is really going to tie into what Anil was saying as well.
Yeah, no, I think that what I was thinking about with this question was just how it has opened up options now that we have, like, let's say, e-health. There's a lot of options in which people get to choose, and I'm all about having more options and providing people with the option to choose.
Yeah.
Right? To seek out what they want to go through.
And I think that's exactly what, sort of hits home with what Anil was saying and what Denise was saying, is about, we go into certain conversations, or we go in as service providers with our own sort of mentality and our own framework of what's going to work. or what might be of benefit. And what happens, I think, for not only for our profession, but also for those that are, struggling or dealing with some sort of mental health issue as well, is the comfort zone, right? And we forget because we're so much on automatic pilot that there are other options, that there is even options. So it sort of looks at, I think also the next question is, how does inequality, because again, we're discussing the mental health in an unequal world, which is aligned with our World Mental Health Day theme. And it is about the acknowledgement and understanding that not everyone across the world, and even within your own community, has the same access. And we have seen people lose their lives. We have seen people struggle in ways that differ from person to person. So how does inequality contribute to mental health issues? Or does it? Denise, and then we'll go Kendall and then Anil, please.
Yeah, of course it creates inequality. One of the things, prior to us coming online here live today, we always have those discussions in the green room. And you mentioned a word, privilege. And we think about privilege and how privilege adds to people being mentally well, and not having privilege takes away and affects people in not being mentally well. I think that the thing is, we have to ask people what works for them. One of the things in our mental health first aid course that we talk about, we talk about that we ask questions. We don't tell people what to do. And I think an effective question is, what does help look like for you today? And so if we can tweak that question and ask people with lived experience, because one of the other things too is that when we're having these conversations, when organizations are having conversations and people that are making the decisions, engaging people with lived experience to find out what works for them. My mom's 84 years old, and, she has specialists that aren't in the town where she lives, and they want to have video calls with my mom. My mom's not having a video call with anybody. That does not work for my mother. What works for my mom is going to see somebody. But we also know in those rural areas, if we think about internet, for example, how are people in rural areas, and even in Ontario, Wi-Fi is not great. How are people supposed to have those appointments? How are people supposed to follow through and have that support that everybody deserves to have when they're struggling with their mental well-being? So we have to have those discussions. We have to find out what works and realize that there's not a blanket answer for everybody, because people have their own experiences with this.
Yeah. I think it's also, highlighting, and Kendall, I'll get to you to hear what you have to say, is, our priority, right, is ensuring that we are contributing to the wellness of another person in a positive way, right? You can have all the credentials and all the letters after your name, and that doesn't necessarily mean that you are the best person to be of a support for that individual. And that tends to be very much what many people are stuck in, that belief is that, I can't help, I can't do anything, I can't make a difference. And that's one, I think, change that is a starting point in really shifting again that inequality that exists. Because yes, there may be lack of services that are accessible, but that doesn't mean that there's lack of community that's accessible.
Christine, can I just elaborate one? I know we have time, right? But just one thing. And I think that what stops people from being that support is that they feel that they have to fix what that individual is going through. We can't fix it. But we can support. And that's what the important piece is having that support in people's lives.
Yeah.
Okay.
Kendall.
Oh, that's a great point. Yeah. It's about support and not fixing, for sure. And I think about the systems. So these systems that are in place that are wanted to help, I think is important that we tease apart equality and equity. So, equality would be giving everybody an Xbox, and that sounds really beautiful, right? We're checking off a box. Equity would be understanding what the nuances are, what the needs are of that specific community or that individual. So I think that is the way that we have to approach it. Like Denise said there, it's not one size fits all. We're not, because it's going to just homogenize and actually depersonalize the experiences.
Yeah.
But rather get to know what people are experiencing and provide how can I support you, and actually get that conversation going. So that's what I think it's about. I think it's about these systems also being held accountable and not just checking off a box.
Yeah. And I think, introduction and discussion around mental health tools, similar to what Anil was talking about, really, again, changes and reframes that conversation. It doesn't have to just be, person in front of person having a conversation. There's different ways of support that can actually still create change of experience within that person's life. Anil, what do you think with regards to inequality as it contributes to mental health issues?
I think language matters, Christina. Language in a very broadest possible sense. We introduced all kinds of terminologies: mental health, digital mental health, mental health therapeutics, and e-health. And a poor person out there sitting in the St. John's or in Goose Bay in Labrador or wherever, they think, what the heck is this? I can't even navigate the traditional services which I'm used to of, and then you're introducing the whole new layer of complexity, and I can't fathom, I can't connect, I don't know what it means, how it fits into a care pathway, how do I even begin that journey. So I think language matters. So my ideal hope would be in 50 years' time, there'll be nothing called digital therapeutics, digital mental health, mental health. It'll be just mental health. It needs to be an integral part of the whole thing. But at the moment, the way probably mental services are, they are more designed with a view to get it right from a design point of view for commissioners of care, the people who are commissioning those services. So I've had a privilege of having worked with many ministers across Canada, particularly with one of the ministers, Honorary Jerome Kennedy, Minister of Health for Newfoundland and Labrador. So it was an absolute privilege. So he was very passionate about saying, we got only 500,000 people and such a large land mass from north to south. And they're small communities. We cannot open a clinic and a hospital for every 200 people. And we have to look at alternative ways. And we have to keep families safe, healthy, and thriving where they live, not let them go migrate to St. John's and Gander and other bigger places. So the point is, we need to understand this is not about creating new things. So this is part and parcel of mental health care. This is how people are communicating. But how do we provide whatever the people need? I think Denise put it really nicely. What do you need? Asking them that. And the answers are there within the communities. There is a beautiful Samoan proverb in a small island nation in Pacific, and they talk about, if you step on the beach on a starfish, which is a poisonous spikes on it, if you step on it by mistake and without medical treatment, it can be very devastating for you. But what the elders would say, and there's a beautiful local language saying that goes along with that you lift the same starfish and the spongy part at the bottom, you put it on where the sting is, and it sucks all the poison out. So what the proverb says, solutions for the communities lie within the communities.
Yes. I absolutely love that, because it is something that we have spent, at least I can speak for Kendall and I, and some conversations that Denise and I have had as well. The importance of community is something that, again, the pandemic kind of removed in the way that we were used to, right? And yet we found it challenging to navigate, how do we reestablish that sense of community? Because now I realize how important it is to me and my wellness, right? And I think that it also, the reason I bring this up is because many cultures put a lot of focus and emphasis and care and love on community in a different way, but there's still that need, that inherent want to communicate with your community and be with your community. So when we look at, either, new immigrants or international students, that have entrusted themselves and their wellness to our way of being in our world, when we're talking to them about mental health, when we're talking to each other about mental health, I think bringing it back to, again, some of the more basic terminology, but bringing it back to that sense of community can really tip the scale a little bit more. And again, by no means I'm thinking that a flip of the switch is going to happen and all of a sudden everybody across the world is going to have access and resources. While that is my dream, I know that that's not a reality, right? And though I want us to sort of start thinking about and exploring, mental health care for all. That's kind of what we are wishing for, and what the theme is hoping for, and all of us professionals across the world are hoping for. How do we actually make that a reality? And I'm not asking for timelines, but at least those first stepping stones, because it can happen. Patience, yes. But I think that it's not far-fetched to think that it could happen. But how do we do that? So Kendall, I'm going to start with you, and then Anil, and then Denise, please.
Yeah, thank you. The first thing that comes to my mind is accessibility. And so for example, I'm thinking about myself as a student therapist. I'm offering cheaper rates, and I have that awareness of how expensive it is. And still, I think that that's not enough, and I think that what we should work towards is actually making mental health not for profit, but actually not for monetary profit, but for the profit of people's wellness. Right. And so really teasing those things apart. And I do believe that, a healthy individual is informed by a healthy community, and vice versa. Mm-hmm. Those things can exist outside of each other. So they really have to be, it's a cyclical relationship which needs to be fed, nourished, and nurtured.
I think it's also a matter of knowing that, we're not always going to get it right, even from a systems perspective, right? So we have to be able to, work towards being in that benefit mindset, right? And that's sort of something that, we've been exposed to. Traditionally we've sort of explored fixed mindset and growth mindset. Well, now we're looking at it from a position of benefit mindset, and that is about the collective, right? And I think that that's, again, bringing it back to that sense of community, bringing it back to language matters. What language are we using? Is this language that is inclusive of those that may not be as comfortable or familiar with openly talking about their challenges? So part of that is all feeding into the same sort of pot, to make the recipe of magic, if you will, to make mental health as accessible and equal across the world. Anil, what do you think with regards to how do we make it a reality?
How do we make it a reality? I think mental health, as a simple word on its own, is a pretty loaded word. It is. I don't know. Yeah, if you are a psychiatrist, you're thinking inpatient and you're thinking of acute care and crisis. If you are a GP, you may be thinking of mild to moderate end of the spectrum. You could be doing some amazing amount of social good in the community. You may be thinking around wellness. So the whole care continuum, goes from wellness to mild end of the spectrum to moderate to acute. So mental health is not one thing. And so for me, we all have different understanding depending on where I am at that point in time in my life. If my wife has just left me and I haven't seen my two beautiful babies for 3 months, and I don't know where she is, I don't know if I see that as a mental health issue as a man. All right.
Right.
So
Yeah.
somebody might say, go and seek help. You have got blah blah blah. But the reality is, so we were talking about language earlier on, but I'm also thinking about stigma. You know,
Yes.
so I may not even relate to that as a mental health issue, and it could be a range of other scenarios, similar scenarios.
Mhm.
So so even if I know it is, I need some help of some nature from some professional. Stigma, I am a so and so, and I have some preconceived notion as a of Indian ethnicity as a background that
Mhm.
it is something not me, not in my family. Nobody is, and whatever the reason, cultural barriers, it could be, and you don't have to be of any ethnicity. You could be anyone. We all have our own biases of some
Yes.
sort. All right, so that stigma alone can, by the time access the first point of whatever the contact is, it could
Mhm.
be such a long delay that it may be too late sometimes. So stigma also matters. So how do we remove barriers to access? How do we provide? And it is a mammoth task, because some of these things are, how do we change human behavior? This is not about just putting a one public service announcement or TV ad and with some amazing Canadian sharing their personal experiences of depression or anxiety on
Yeah.
television. The human behavior takes many iterations of many years of going through a process for you to change the way you think. So my thinking is stigma matters. How do we improve access? I'm looking at some of the major mental health services where young people are accessing. So they have been the way they've been positioned is as they're not mental health services. So you are reaching out to the service called the lowdown. All right.
Right.
So the lowdown is the thing you're not accessing mental health services. But if you look at 100% of the threads of the communication, they're
Mhm.
all about mental health. All right. But it'll start with something very as simple as life sucks. All
Yeah.
right. So what I'm trying to say is stigma, and how do we, destigmatize and improve access, the first point of contact.
Yeah. I think it also is, something that you touched upon. In addition to the stigma, it's also experience, in the sense of having that conversation and knowing what that is. You only know what you know, and you don't know what you don't know. While having that conversation around mental health and identifying certain warning signs or even certain life experiences that may challenge that mental state, is something that, yes, I can have that awareness because I have the experience, and I was raised in Canada, not necessarily in a family that openly talked about it, but my experience outside of the home provided a platform of awareness and education around it's okay to have those conversations. But I also know that family of ours that still reside in Portugal don't necessarily have that same experience. So I think, yes, the stigma, but it's also taking that perspective of we only know what we know. So we typically do what we know, and we do it with ease. So bringing it back to earlier points about like asking that person what they need, asking even how they talk about things. Who do they talk to? Do you talk to family? Do you talk to your friends? Do you not talk about it? Do you internalize? Do you do certain practices? I also think about, sometimes we give suggestions, like self-care practices, and I kind of like, you can kind of see my head kind of doing this because I chuckle a little bit, because how we explain self-care practices as a means of helping and assisting the struggles is about taking care of yourself first. Not all cultures like that, but yet they themselves, those various cultures, also have ingrained practices that would be considered self-care. It's just not labeled that. It's not positioned in the way of you're taking care of yourself. So I think part of what also needs to happen in really trying to move forward and create, a pathway that can make mental health for all a reality is education. But it's not only education around mental health and what that means, it's education that we all need to make about others, other cultures. Let's learn, let's explore, let's not keep ourselves in what we know, but possibly explore things that we don't. And that I sort of look at, that being an asset of many communities that we actually have, that we can build upon. So many communities that I've come in contact with worldwide, it's, you've got so many different variations, so many different races, genders, cultures, beliefs. I hate to use the word melting pot. I really don't like that term. I look at it as, a wonderful flower pot that of various seeds that have bloomed together. And that's an asset that communities have that I don't feel that we're tapping into as much as we can. And again, it's an overarching theme that we've talked about community and connection and looking at options, right? And variations of services in the modality of deliverables, but also in access, right? And knowing that we can all be that access point of support. So, Denise, what do you think, what assets do you think communities have upon that we can actually build towards, again, making that a reality?
Absolutely. Well, you said the word training. I mean, that's what you said, Christina. And, there's so much, like we could probably talk all afternoon because there's so many points that both Kendall and Anil were making that I'm like firing here, but language. And, to go back to language and realizing that, in Canada, the number of immigrants and refugees that we have from all over the world. And we, number one, have to realize that using respectful language is one way to build rapport and trust. Using respectful language also diminishes the stigma that is out there. We have to understand that when we are being a support to somebody, it's not about labels, it's not about diagnosis, it's about signs that you've noticed that somebody's experiencing a decline in their mental well-being. We have to realize that not in every culture is there words for specific mental health problems. So if we have a neighbor that is from another country, we aren't going to be coming in and going, oh, schizophrenia or that. No, we're not going to use that because that's going to shut that conversation down. What we want to talk about is what is it that you've noticed that you're reaching out to your neighbor? What changes in behavior? But the training piece, and when we look at how have we tried to meet the demands of the pandemic, mental health first aid prior to the pandemic, we did not have any virtual courses. We now have 4 virtual courses. And we're just upskilling to face-to-face, which is blended. But we're now having that opportunity to train more Canadians in being a support, because it's not about diagnosing, it's not about being that therapist, but it's about being able to be that support. And so, workplaces being able to incorporate these trainings, because you think about where do you spend the most time of your day? You spend it at work. We think about at the commission, we have the psychologically safe and healthy workplace standards. And one of the newest programs at the commission is the Quality Mental Health Care Network, which is helping to give access to quality mental health care to those rural communities. There's a project, it's called Step Care 2.0, and it's actually a roadmap to help communities to decrease the wait time and improving that care for individuals struggling with their mental well-being. So I encourage any of the viewers here today, if you are in those positions where you're making those decisions, please check out the commission's website for the different supports that we have and the different trainings that we offer across the country from coast to coast to coast.
And again, that sort of reiterates, the pathways of care, right? The pathways of care have evolved. And we look at all the various, all the various stepping stones within that sort of blueprint or within that house that is ours, all have a place, right? And there's so many different ways that we can actually be that support network, So the earlier discussion, we sort of spoke of COVID and the fact that, that isolation or that remoteness that we've all sort of had to experience because we had to isolate and we had to keep ourselves safe and keep others safe, really highlighted as well, I think, and it changed some of the conversation around that digital or virtual type of delivery when it comes to professional services, right? And, previous to that, it was let's be honest, there was a lot of debate that went on to, how successful or how effective, pardon me, would that be? And yet COVID really highlighted that it doesn't matter, right? It is about that trust. It is about that rapport, and it's about the unique needs of that individual. And is there a match there? So, Anil, I know you spoke a little bit about the digital mental health and that aspect. Can you sort of elaborate a little bit more on how, with regards to that pathways of care, how that has further evolved our systems by introducing that?
Absolutely. Yeah. So look, I just want to quote a colleague of mine. She lives in Yellowknife in Northwest Territories. You must be wondering why this Kiwi knows so much about Canadian provinces. Uh, so her name is Sandy Little. She is one of the healthcare in health department, and I just love her quote. She is it's just so beautiful human being she is, and she is so passionate about technology. But she would not talk about mental health.
Right.
Right. So she says we are a landmass of 1.3 million square kilometers. That's 5 times bigger than the size of New Zealand. Just that province, one province. Only 44,000 residents in that, and such a huge place, 44,000. She talks about mental health is not an innovation, it's not a luxury, it is a necessity for us. Without that, we have nothing, no hope to deliver what we do. And she puts it so eloquently, so beautifully. So for me, that is the ground reality for a lot of people. We might think in living in Toronto or in Auckland and some major cities, we're thinking, oh, let's do this because we have got a clinic only a kilometer away or some other services only a few kilometers away. But for them, you can drive for hundreds of miles, there's nothing. There's a barren land. So for me, how it has, so just to simplify for some people who are listening for the first time around what is mental health, what does it even look like? What does, so I just want to, in a very simplistic way, if I can give you one brief example. So if it's a youth mental health service called the Lowdown here in New Zealand, and if people, the school guidance counselor might give you a wallet card. In the old days, these days they might give you through some digital means access. And basically all they give you is the Lowdown, nothing to do with mental health, and a text number called 5626. That's all. So it's been running since 2007. So just give you an idea. So this is nothing to do with pandemic and nothing to do with last decade, 2007. And so young person sends a text message to say life sucks, and somebody writes back, dear Christina, so sad to note you're going through some challenging time. Your mom and dad are fighting all the time. Your exams are just around the corner. Is there anything we can do for you? Would you like to talk to somebody? Regard, Anil, all right? And 1 in 3 Christinas write back saying, are you a real human being? Because this is not automated ISP. So by the end of the day, what I'm trying to say is then there's a therapeutic alliance also, what are the contact is happening. So that's when the magic unfolds.
Yes.
All right. So in the first month of that service going live, there were 19,000 individuals who contacted that 5626. Right? So I was in front of the Minister of Health in New Zealand a month later. He said, where were these people going before? Yeah. I said, I didn't have any data on that, but I said, probably nowhere, Minister. They were just loitering around and street corners, and all of a sudden they have a channel to communicate. These days, those services have proliferated, Kid Help Phone and all these amazing services are all over the world, in Canada as well. So basically, it's about the human contact, because those people don't see that as a mental health issue. So, they want to access things in the way they understand, which is easy to access. And bang, 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 we talked about the language earlier on. So the way, just think about it, paint a picture for yourself. The people on the other end are in New Zealand, our Ministry of Health funded staff, they're therapists, they're trained people. And so it's not a free, it's not volunteers on the other end. So we are talking about a very structured service, but young person does not know they have entered a service which is for their well-being. All right.
Yep.
So we would never classify that as a clinical service.
Mm-hmm.
So there are three types of e-mental health solutions. One is I would never be seen talking to another human being because it's not my comfort zone. I'm a stoic man, and I'm a real man, and I'm a farmer, and so a lot of people, for reasons of stigma, may be able to just Google away and find something. There are 5 million digital health downloads every single day in the world today. Whether we prescribe them or not, whether we guide people, people are doing that.
Yeah.
And there are so many solutions out there, more than 375,000 solutions right now. Only 29.3% of those are safe and effective.
Yeah.
So how do we even ensure as the custodians or playing our role, what we play in healthcare system, to make sure the people access the ones which benefit them, not the one which harm them?
Yeah.
Right? So there is one is if I'm a stoic man, which I painted a picture of, then probably I'm happy to access something which is pure self-management, no human involvement. So
Mm-hmm.
there are thousands of those solutions. So I'll do pure self-management. It could be around budgeting because I'm finding it hard to make ends meet. And the second one is what I talked about, the lowdown. There's a human being on the other end.
Mm-hmm.
The baseline qualification we are looking for that person is a huge, good listening skills and empathy skills.
Yeah.
That's what we're looking for, nothing else. And so holding a safe conversation. And the third one is clinically supported on the other end. So basically, that you are in a clinical environment at the time, and they are the most expensive services. So e-mental health is not one thing. It is, depending on how they've been commissioned, they're structured differently. And in Canada, and you are very lucky to have amazing array of services in that area. But I think when I think about mental health, I think of the world, not just one country. Grief of a mother losing a son or a daughter in Canada or in Alaska or in India or in Africa is same. So my thinking is, we have our families. You talked about Portugal, and we have families living all over the world these days. Doesn't matter who we are. So mental health is the political boundaries, the country boundaries as we know them. They're political boundaries because this is Canada border and this is where US starts and all of that. The thing is, I think of this e-mental health dismantles all those boundaries. And so I get very passionate about this subject.
But it's true, and it's amazing to see that passion, because I think that passion also inspires others to take a step back and reflect on what they know, and again, what they don't know. Here through GuardMe, we have a very similar, more of like, again, a digital sort of remote access to mental health services for our school partners, for their students. And really what it provides is, again, that option, right? And those those variations of resources. So self-help directed resources, that texting, the calling. But what we need to remind ourselves of, regardless of it being in person, regardless of it being video, chat, mental health is a unique human experience. And when I say a unique human experience, we can all be facing the same situation, but walk away with a very different experience. The pandemic was a perfect example of that. And yet how we deal with that same experience is also very unique. Some can deal, some can't. And it looks at what is in the foundation, what is around and accessible to help those that can't. So it brings it back to, again, that sense of community. What access points in community can we actually leverage? And those various pathways of care and how they've evolved within our systems. Kendall, I want to hear with you on that question. But before we do, I just want to invite anyone that's listening live. If you have any questions, now's the time to sort of type them in, and our panelists will answer them at the end.
Sorry, Chris, what was the question?
So with regards to your perspective and thoughts around the evolution or how pathways of care have changed, and maybe how the influence or asset of a community has contributed to that. And if not, how can we build that together?
Yeah, absolutely. I think the pandemic, fortunately and unfortunately, provided a moment of pause, and actually for people to look at what assets they have, what internal coping mechanisms they've utilized, and how they could actually. I guess they also got to see the need for community in terms of like how they're impacted by the isolation that was happening. I think during the pandemic also we saw the worst of human behavior, in the sense of you saw people suffering and just trying to get back to what was, and doing anything by any means to get back to where they were. So I think that it's continuing to provide spaces for people to come together, explore their experiences, like we do in our community connection that we offer up for our community members. But it's about having that moment of reflection, looking at where I've been, identifying the resilience that it took to get to this moment right now. And so I think it's about creating those spaces, continuously creating those spaces, and knowing that there's community, and even though we're different, there are universal themes that we do experience.
Yeah. And I think that it also really reiterates, the purpose of today's conversation was simply, or at least what I was hoping to achieve from this conversation, was just reiterating that we all have a part to play in the change that we want to see, right? So if we have that awareness, right, that things are unfair, if we have the awareness that the way things are being done, it can be better, right? Well, you have that awareness. Now reflect, what are you going to do about it? And you don't need the credentials behind your name. You don't need the schooling to be an influencer of that positive change moving forward. It's kind of what I was hoping to achieve by also shedding the light of changing how we view pathways of care, changing how we view support. And that can contribute to also changing how we have that conversation. So I'd love to hear from each of the panelists with regards to, entering today's conversation. What were you hoping to achieve? And did you? So Anil, I'll start with you, then Denise, and then Kendall, please.
Well, it's been a privilege being on the panel. So the two things I would like to make a comment on. And one is, mental health, as I said, is a very loaded word. I'm always in despair when I hear about the wait list and wait times before you even have the first contact with the service, even if you are accessing them. Yeah. And I don't want to name the countries and how many months it takes. So technology, digital mental health solutions can be that beautiful, safe space where you have something rather than nothing. So, but going back to the community aspect, which I talked about, and I always look at it as there's a beautiful initiative out of Zimbabwe, which talks about a nation of 14 million people, only 12 psychiatrists for the entire country. So they said, even if we double the number of psychiatrists or quadruple it, do we still have enough? So the point is, we need to think outside the box. So one of young psychiatrists came up with this beautiful project where they trained. They said, what is the most important asset in the country, where elders are regarded with high respect for their wisdom. So what they trained is all the grandmas into listening skills and empathy skills, and created these benches, wooden benches, which grandmas could go and sit, and you can go and sit with the grandma and talk. So they're called friendship benches. So people are just, and it's been a phenomenal success. It's just a basic. This is what I was saying. Solutions for the communities lie within the community. The resource was there; it was untapped resource.
Exactly.
Now, so I look at that digital solutions as a digital, kind of a friendship bench. That's what it is. That's where people's languages are. So it's been a privilege. Thank you so much.
Thank you. Denise, what about you?
Well, first of all, I'd like to go sit on that bench with a grandma. I would love to be able to do that. I think that what I would like for viewers to leave with today is that we all play a role, every single one of us, and that we all have that ability to be that support, to hold that space for somebody and be that support and help them. It's important for viewers to also understand, like, have a better understanding of the resources that are within your community or that are available. So for like example, a great resource is Heads Up Guys. It's a out
Yeah.
of BC, and it's specifically for men. So this goes back to what you were saying, Anil, about how that, big burly farmer's like, I'm okay. Everybody needs support, and everybody deserves to have that support when they need it. And so being aware, like Heads Up Guys is for men that are struggling with depression, and it's a great resource. And so having that awareness so that people don't feel alone, and take a course, go on to MHFA's website, take a course, build that tool belt that you have that allows you to have that safe and comfortable conversation and continue to be that support with those in your life, whether they're your professional connections, your personal, but every single one of us has somebody in our life that struggles with their mental well-being. So let's become better equipped to be those supports to others.
Wonderful. Thank you very much. Kendall?
Yeah, well said, Denise and Anil. To just build on that, I think it's really about community coming in and getting the tools and understanding how to use the tools. So not just giving them the tools, but providing the education as well. And I think it's about early prevention. So, like Anil said there, that's a pretty wild stat in terms of like the ratio of psychiatrists to how many people may need support. So it's not about providing, that becoming a silo, right? And saying, oh, we need you guys to take care of all the mental concerns here.
Yeah.
It's actually redistributing the knowledge, the awareness, the resources, so everybody can be a part of the process, because everybody is. We are impacted by the experiences, either indirectly or directly. We're impacted.
Yeah, thank you.
Mm-hmm.
Thank you. Now, I do want to just extend another very heartfelt special thank you to all of my panelists to join me today. Thank you. And to those that joined us live, thank you as well for taking the time. I will say that the contribution that our panelists have left us feeling has been inspired, motivated, and even encouraged to do our part. We are continuously reminded that mental health is a human experience. It's part of being human. How we define it is unique to us. That doesn't make it any better, doesn't make it any worse, doesn't make it any unequal. We all have an element in our health that influences how we feel, how we think, and how we behave. That is our overall well-being. We are also reminded that having those days where we're just not feeling the greatest, where we might be struggling, is part of a human experience. It is also part of being human. On our path towards a more equal, accessible mental health type of experience for all, making that a global priority starts with us. We must not forget that mental health struggles, stigma, does not discriminate. So what are you going to do? What is the part that you are willing to commit to with intention to create mental health for all as a global priority? And with that, I say thank you.